4%. So this younger demographic, millennials and those are slightly older, are more represented in these numbers than people who are, let's say, that are 70 years of age and older. So I just thought that that might be instructive, and that's why it's very, very important for people to engage in social distancing, to avoid the large groups, avoid the private partying, for example, and to really take this situation very, very seriously. And so as we move forward, especially as the numbers will grow, I've asked my team and people at the health department to be a little bit more granular in their analysis so that we can have a profile of who's in these numbers and where they are. The other point that we want to make, we want to provide this week, is that, for example, in this now number of 286, how many of those individuals are in the hospital, and how many are self-resolving, being attended to, taking care of themselves at home. I think that too will be a very instructive number, because most of the people that's in this number, this 286, for example, they are attending to their situation at home and not going to the hospitals. But we do expect the numbers to grow as we do more testing. As now with regards to testing, over the last 24 hours, we've been working with all of our stakeholders, with FEMA and the county, the city, all of the partners, to try to make sure that we are able to continue to test in the city of Houston. Butler will continue to test, and we are working out our situation with FEMA and CDC and others, because we're looking to stand up Del Mar. My hope is that we'll be able to stand Del Mar up as soon as Tuesday. The only thing that's holding us back on the PPEs, and we're working on that. And then over the 24 hours, I think we've gotten further clarification. They will be providing us with the initial supplies in order to do 250 tests per site. So that would not, so it's not going to be 250 combined as it relates to two sites, but 250 per site, and that will help us to be a little bit more robust in our testing, which will help us to give a better sense of what's happening in our community. And again, I want to thank Representative Jean Wu and the Shanghua University, which is alumni, which is a part of the Asian Chamber. Earlier today, they provided us with an additional 2,000 surgical masks, 500 N95 masks, and some face guards, which will help, and we'll utilize some of these to set up the additional site. And then I've gotten good news that Shanghai, China, is already sending in, and they are already en route flying to us, 1,200 N95 masks and 20,000 KN95 masks. And so that will help in our testing capabilities. You know, I spoke with the Consul General on Friday, the Consul General of China on Friday of last week, and then that afternoon he said that some additional help will be provided to the city of Houston, and then we got word that a total of 21,200 masks are already en route in the air heading to the city of Houston, and that too will help us to stand up the additional sites. And so if there are others out there who also are interested in donating to the city of Houston, please do so. We certainly will appreciate that. And all of this is in addition to the equipment, the PPEs that we are seeking to purchase in the private sector, in the private market, and so we are doing that as well. So we want to get these testing sites up, both of them up. Then the county has 2 that's up, and then the more we test, the better we can identify people out there with the virus, testing positively. Then we can engage in the tracing, and then help to isolate people and have people quarantined, and that will be good for everyone. But I fully expect that the numbers will continue to rise, and then that will help us in addressing our situation in the city of Houston. Now let me pause for a moment, and let me bring up first Chief Acevedo, and then followed by Chief Pena. And you can also further talk about the testing if you got any additional.
Yes, sir. Thank you. Hey, good afternoon, everybody. Thank you, Mayor. Thank you for having us here, Sam and I here, and thanks for everything you're doing for our city. First I want to bring up to speed the community is the fact that the police department, our call volume continues to soften. We've seen a slight reduction in our call volume. That's been what we've been seeing since this event started, and we're thankful. We're thankful that our community is being thoughtful in terms of the way they're conducting themselves, and most importantly, being thoughtful in terms of when they call the police or fire, and I'll let Sam speak for himself, but that's a good news. The other good news is that so far we continue to see a downward trend on our violent crime, with the exception of domestic violence. They're slightly up, and assaults, they're slightly up. And I would just say anecdotally, that's probably because people are at home, and unfortunately, you know, sometimes people get a little emotional and can make bad decisions. But we are at 100% capability, capacity, and we are responding to all calls. I just got word a few minutes ago that we're up to our 11th officer. We had another officer that came back positive today. So we now have 11 officers that are positive. Out of the 11, 10 are doing really well. They're in isolation at home with their families, isolated from their families, but at home, and one remains hospitalized. The one that remains hospitalized is a male classified employee, sworn employee, who's early 40s in good health. He's doing better today. He actually had some toast, and other than being on oxygen, we're very hopeful that he'll have a full recovery. The last thing that I want to speak to is the fact that we are going to continue, both of our agencies, to enforce the stay-home order, but we're enforcing the spirit of it. Having said that, when we have reports of people on Lake Houston that are actually getting together and not obeying the stay-home order and congregating in large groups on sandbars with a bunch of boats, that's just absolute, people that are absolutely ignoring not only the spirit, but the letter and the spirit of what we're trying to do. And I think, Mayor, it speaks to what you spoke about, that older people like us are taking this very seriously, and consequently young people are not, and that's why we're starting to see very large numbers of people well under 60 or 50 that comprise the majority. We will start citing people when they absolutely flaunt this stay-at-home order. And so if you're going to completely ignore it and do what you're not supposed to be doing, which is certainly not hanging out together in a bunch of boats congregating, you're going to end up getting cited. So please don't do that. Lastly, in Spanish, queremos que la comunidad que sepan que el Departamento de Policía sigue funcionando en 100% con la capacidad. Esta tarde me dieron notificación que tenemos otro oficial de la policía que está positivo para el virus, y esos son 11 policías que tenemos ahora positivos para el virus. Gracias a Dios, 10 de ellos están en buenas condiciones, no tienen ningún problema, están en su propio hogar en isolation, pero al fin del día tenemos solamente un oficial que está en el hospital, ya lleva varios días en el hospital, pero está mejorando todos los días y tenemos gran esperanza que va a estar bien. La última cosa que quiero decirle a la comunidad, que por favor, gracias, porque estamos viendo las llamadas para el servicio de la policía, llamadas de servicio siguen bajando, el crimen sigue bajando un poco, lo único que está subiendo es la violencia doméstica y los asaltos físicos. Por favor, tengan paciencia, tengan respeto, y si necesitan la policía, por favor, llámenos, aquí estamos a sus órdenes. So again, we're at 100% capacity, Mayor, and we're able to respond to any eventuality.
Thank you. Chief Hayden, all right.
Thank you, Mayor. Thank you, Chief. So I want to give you a quick update as far as the status of the Houston Fire Department. To date, our call volume has remained flat. Our vehicle accidents have dropped down, but it's being replaced by medical calls and medical 911 calls. As of an hour ago, I got a report that we had our 5th firefighter that has tested positive for the coronavirus. That is in part of the group of the 91 that are in quarantine. And we've had a total of over 620 firefighters that have had some level of exposure since this operation began. The word is that our 5 firefighters are doing well at this point. There has been no report of a complication that requires hospitalization, so that's a huge positive. But look, we're facing an invisible threat, and this virus is no joke. And so we're taking a different approach as far as our response, and that we are making the assumption that every person that we meet is now infected, okay? So you're going to see a difference in the approach from our firefighters. They're going to now be doing a distance assessment of no less than 6 feet. with one firefighter before they bring in additional personnel to treat that patient, right? Now, it doesn't change for any cardiac arrest or trauma that requires immediate action. Our firefighters are going to be on the spot and function the same. But for the majority of our medical calls, those that we can do an assessment, a safety assessment, we're taking that extra precautionary step for the protection of our firefighters, their families, and ultimately, we want to avoid being the cause of infection to our patients as well. I think one of the sobering statistics that the mayor mentioned is the high number of younger personnel that are being affected, or in that group of affected personnel in this county. Look, as a young person, you may be at a lesser risk to get serious illness, but you are at a higher risk of exposing others. And so it's important to be prudently cautious, practice the physical distancing as has been talked over and over, and you know, let's do the responsible thing for this community. And together we're going to get through this. But as of now, our staffing level is we're able to staff all our apparatus. But the more people that get infected, the more people that are taken out of the game, it's going to make it more difficult for us to maintain that operational status. So we ask the general public that when they call 911, please let us know. Let us know if there's anybody in the home that has symptoms of fever, a cough, respiratory difficulty, or any flu-like symptoms, okay? That'll better prepare us, not only fire department, but the police department, to better attend to your needs. Okay? Thank you.
Thanks, Chief Pena. So again, want to underscore between 20 and 60 in that first 232, that first 232, that group between the age group between 20 and 60 represent the majority of the positive cases from COVID-19. 20 to 60, not 70 and up, but 20 to 60. And that's the importance why we want to emphasize social distancing. And please, please, restrict your gatherings and the private partying because it's not going to help anyone. And then in that group, and then if you're visiting your parents or your grandparents, you have to be very careful because you'll be taking it to them. Okay, so we're all interconnected. And the other thing that I want to underscore, we're not waiting until our numbers are just astronomically high. We are looking now to build that capacity, to at least have that where we know where that capacity is if we need to go to it. That's why we're touring facilities like the one today. And again, I want to thank Dr. Gobalani and Dr. Fraze. Yes, that's what I said. I want to thank these two who are the owners of this facility. And quite frankly, if we needed it today, it's ready to be stood up today. And then at the same time, we're continuing to find and build capacity for our homeless population, and then for our first responders, city employees who may need to be quarantined, can do so at their homes, and then we want to make sure that they're available. And on that note, this coming Wednesday on the City Council agenda will be an ordinance to give an authorization to lease 2 hotels, room capacity 180 beds. That will be before City Council this coming Wednesday for them to vote on. Having said that, I'll pause and take any questions that you may have.
Is that for first responders?
First responders, city employees, and even the homeless population who may need to be quarantined.
And which hotels are you looking at on those?
I can give you that information, but they're in the city of Houston. I think they're in the immediate southeast area, but there are 2 of them.
And one other thing there, in terms of bed capacity, how many additional beds are being looked at?
You know, I've asked for that information. There are several things that I'm getting information from that hopefully I can make available for you this week. And that is the number of beds that we have in our region, what's the utilization percentages right now, and I'm being told that we are under our utilization. And that's why it's important to flatten this curve, to spread this out over several months and not just all in a few weeks or 1 month. So we are under our utilization rate, which is good. In terms of ventilators, I've asked that. We do have significant number of ventilators that are not currently being used, but ready to ramp up. and we're keeping a close eye on that as well. And then looking at the number of people who are currently in ICU in our 25-county region. For example, this past week, we got up to about 70 to 77 in ICU beds, and that's in the 25-county region. So there's still capacity and room there. And as you can see, at this facility alone, there are 21 ICU beds. And then we're looking at the number, you know, it's one thing to tell people how many cases, you know, 282 cases, but what is also key in that is how many are going to the hospitals and how many are self-resolving at home. And so we want to provide you with that information as well. And so the health department and Dr. Purse are going through providing that granular information. And that will be, I think, will help people to be instructive to know that just because you get it doesn't mean you're instantly going to the hospital. A lot of people are self-resolving their situation at home. 80% of those cases, and then you got the 20% that will be a little bit more serious.
You say this hospital is ready to go. Talk about just how ready it is, how many beds are here, how many people are going to be working here as far as healthcare professionals and the ventilators. In
terms of the capacity of this particular facility, there are 68 beds that are available. Of that 68, there are 21 ICU beds.
Can you re-say that?
ICU. You know, that are ready to go. All the hookups are available. All they need now is the equipment, and then they're ready to go. In addition to that, they have the capacity to, in this facility, to expand even beyond those 68 beds to even add many more beds. Quite frankly, based on, in our observation, I think we can easily go up to 100 beds right here in this facility. The cafeteria, commercial, all already in place. And the other good news is that this facility was used as a hospital. So that's why it is ready to stand up if needed right now.
Have you utilized all 5 floors? Or?
All 5, the whole building would be available to us. And it's a situation, for example, even if we needed to use for our homeless population, we could do that as well.
And as of right now, this is the only facility in the city of Houston?
No, there's another hospital that we are also taking a look at that's on the west side. We are identifying several facilities that were hospitals that are no longer hospitals, but we can stand them back up very, very quickly. So we're identifying facilities all over the city, just in case they are needed. And then we are partnering with the Texas Medical Center and the hospitals, which really would be the ones, if you needed, would stand these facilities up.
So was this hospital not operating before?
They were operating. Kindred Hospital was here, and that lease is coming up to an end this month. So it's just fortuitous that at a point in time in which we may need it, it's ready to transition for our usage.
The governor announced today he needs folks to come forward if they know of any available spaces to house people. Last week, we're told a group called XP and E-Consulting reached out to the city offering multiple hotels. Anything about what the response has been?
We have had offers from different people and hotel owners, which would equate to about 3,000 hotel beds if we need them. We are going to be entering into a lease with 2 of those hotels this coming Wednesday, assuming the city council says it's the same. And we have them in our inventory. And so, you know, to the extent we need to move in that direction, we want to be ready to go. We don't want to be having to scramble and then to find at the point in time in which we need it. That's why we're carefully watching the numbers. We're seeing how things progress. We're carefully kind of monitoring what the status of the hospital systems are in our respective region, such that if we need to transition and do something else, the capacity is already identified and we'll be ready to go. And then on top of that, the Corps of Engineers, of course, is another entity that we can also utilize. So it's almost like identifying everything that's available, assuming the worst scenario, and preparing for that right now, instead of waiting until you absolutely need it.
Chief, can we talk to you?
Sure.
You now had 11 officers that tested positive. Yesterday, one of the officers talked about different approaches, seeing more officers wearing masks out there. Yeah. Are you providing officers now, everybody, patrol officers or even TAC officers?
We've actually changed our operational requirements for our officers. We are now telling them to actually wear their N95 mask, gloves, and eye protection when they anticipate going hands-on. Because at the end of the day, remember the one thing about our profession, we can't maintain social distance, and at least in our case, we don't have the most cooperative people sometimes when you're trying to take them into custody. And so all the officers on the front line should have the N95 masks. You know, the entire nation is experiencing challenges with getting sufficient supplies. It's not just Houston or Texas, the entire nation, and but we still have enough for the next week or so to keep doing what we need to do. The other thing that we're looking at is that we're looking at being able to use the masks as long as they're not there's not a known exposure to it, or as long as they become wet. We're actually having them put them back in little plastic bags and reuse them. We've also are consulting to looking how we can actually disinfect the masks. So we're in pretty good shape, and you know, 11 people, but that's what we come to work for. This is a historical event, and quite frankly, I'm pretty proud of the way all of our organizations and this community is responding. Last thing that I wanted to say that I forgot to say earlier is I know there's a lot of people worrying about the supply chain, the food supply chain especially. I'm spending a lot of time while I'm driving around the city going into supermarkets, into CVS stores, into all these places just to keep an eye on what it looks like. And so far, just like the mayor has talked about many times, it continues to be in good shape, so please don't hoard. Okay, thank you.
Did the doctors want to say anything? Do you guys want to talk about how this hospital can work?
This is a functional hospital till 31st. As a matter of fact, their lease expires on 31st. For one reason, it was a working hospital, and I think the city can use this hospital. It's everything like they mentioned about it. Is 21 ICU bed. They can be initiated, you know, within few days, and all the connections are here. This building is built for the hospital, and the hospital was running for at least last 10 years, and they were running pretty good, and they have been approved by, they've gone through JACO inspection, and they can go through all the inspections, and they're in first grade facility. As you know about it, it's a very clean and functional hospital, can be converted anytime. Thank you.
Mayor, can I ask you one question? How are you feeling now with the progress or where the city is in this?
You know, I take a look at cities all across the country and even outside of the United States, and we know, you know, New York is really taking it on the chin. You try to learn from what's taking place in other areas, and you know, we don't want to reach that point. And in order for us not to reach that point, it was important for us to take some very significant steps to tell people to stay at home unless you're an essential business. And if we can flatten the curve, then we can keep from getting to that point, for example, where New York is. But the reality is that if we don't take those steps, we can all be in New York. Okay, we can all be there. And so we have to take it very seriously. The numbers and I've had people say, you know, Mayor, we're the 4th largest city. We've got 2.3 million Houstonians, and you have now 284 cases. That doesn't seem like a whole lot, Mayor. But the reality is that our testing has not been nearly as robust as I would have liked it to be. And so I don't want people to be deceived by the number, the low number. When you hear, for example, New York having, you know, New York City having 25,000 cases, or New Orleans, you know, having a large number of cases, and then you say City of Houston, as of today, 286, that doesn't appear to be, you know, a large number. But the reality is we know that there are other cases out there that we just haven't tested. So, you know, I like the fact that people are complying. I appreciate that. We know that there are a lot of people who have lost their jobs because of the measures that have been put in place. And a lot of people are staying at home, kids are out of school. But if we adhere to the measures that have been put in place, and if we work together, then yeah, we can come out of it a lot sooner. But the goal is to blunt the progression, to stay well within our hospital system's ability to take care of folk. And if we can do that, then all of us will benefit. But I know the numbers are going to rise, so I don't get upset about that. You know, we're trying to minimize the number of people who will lose their lives in the city of Houston. We're at 2. I certainly would not want any more. And that's why we tell people, if you're sick, you stay home, okay? And at the same time, we know that most people are going to self-resolve their situation at home, and so we want to save the hospital space, bed space for those who really need it. So I take it one day at a time. It's a one day at a time. This is not going to be a 1 weekend done or 2 weekend done. So I just want people to understand that. So we got to be very patient with one another, and the virus will dictate the schedule. We will not dictate the schedule.
Does FEMA tell you how many tests you're going to get, testing kits you're going to get every?
They're telling us right now 250 per site.
250% just this week, or?
Over the last 24 hours.
Per day.
Per day. Over the last 24 hours, they're saying that we can work with you. If y'all can also work with the PPEs, help us with the PPEs. We can do 200. We can provide you with what you need. 250 tests per site per day.
And today, the governor talked about the borders now between Louisiana and
Right.
Texas. Talked about stopping people, making sure they fill out the forms. What do you have to say about that?
Well, you know, I said weeks ago, if you travel outside the state of Texas, when you come back to the state of Texas, you should self-quarantine for 14 days, whether that was international traveling or traveling outside of the state. And I don't care where it is, Louisiana, Oklahoma, it doesn't matter. Number one, no one really should be traveling unless you absolutely have to. But even with some of my people at the city of Houston, for example, when they had to travel outside the state of Texas to go and get their kid from college and bring them back, they had to self-quarantine for 14 days. No signs, but still. So, you know, I've been saying for weeks, if you leave the state of Texas and you come back, especially for city employees, you must quarantine for 14 days. And then lastly, with respect to first responders, police and fire, let me tell you the best way that you can help them. For firefighters, if you need a firefighter, let them know, the operator know that you have flu-like symptoms or cold, and that will help them ahead of time before they get to you. So if you let them know. For our police officers, the best way to help police officers, don't commit a crime, and then you won't need us, okay? So the best way to keep our police officers, first responders safe, and let me just make my plea. Until the coronavirus is resolved, criminals take a break, okay? Stay home, okay? Stay home. And don't commit any crimes. And that way, they'll stay safe and out of jail, and police officers will stay safe and can go home to their families, okay? So everybody chill. Crooks, criminals, you chill. Wait till the coronavirus is over, okay? And then we'll all be okay. All right, thank you all so very, very much.
Hopefully their thinking will change by then.
I'm hoping.
And Scott McCollum will be there with Mayor. It's not that far from here. Yeah.
Somebody's phone keeps going out of it. It was you, Doc. 20 laps.
Yes, sir.
Huh? Which one?
Right here off.
It's on 40th. It's on 40th.